Hello.
Hello.
How are you?
Awesome. So good to have you here. Thank you for joining us.
Of course, it's my pleasure.
Awesome. Hi, everyone else that's joining us today. Really quick before we get started, I just want to say, to get this out of the way, that the information provided on this live is for educational purposes only. It does not substitute for personal medical advice. We advise users to consult with a medical professional or a healthcare provider if you are seeking medical advice, diagnoses, or treatment.
Absolutely.
All right. So now that that is done, I just want to say welcome, everybody. Thank you so much for joining us again for another segment of Derm Talk. I love these. They've been so much fun, and I am lucky enough to be able to host another one. So my name is Linda. Thank you guys for joining us. Basically what these segments are, we sit down every month with a dermatologist from our dermatology advisory board, and we talk about all things skin. So whether it's skin care products or skin concerns that you might have or anything like that at all, we cover everything on these. So we're so glad that you guys are here to join us. And also, any questions that you guys might have while you're watching this, please be sure to write them in the comments. We're going to get to as many as we possibly can. And yeah, any questions that you might have, like I said, put them in there. If we don't get to them today, we will absolutely get back to you with the answers and things like that. So please don't hesitate to put those down in there. Yeah, because we want to be able to help you guys out. Whatever your questions are, we want to answer them for you. So, and who better to get the answers from than these amazing professional dermatologists who are here to join us. They are literally in the business of skin, so they know what they're talking about. But yeah, please send us our questions as you come up with them. I want to dive in today really quick because we have so much information that we'd love to go over today. But before we do, I obviously want to welcome our amazing guest here today, Dr. Ruth Jobarteh. She is a senior dermatology resident doctor from New York. So welcome. Thank you so much for being here with us today.
Thank you for having me. It's a pleasure.
Of course. Before we dive in, can you just tell us a little bit about yourself? A little bit about you, how you got into dermatology?
Absolutely. So I'm half Nigerian, half Gambian, but I've been in the U.S. for the last 12 years. I went to medical school in D.C. I went to Howard University College of Medicine. I got into dermatology during my third year of medical school because I wanted to be a surgeon. Unfortunately, I didn't really like it too much, but I still wanted to do procedures, so I shadowed a dermatologist, and I really enjoyed it. I really do love being pretty much a dermatologist in training, almost done. I have 6 months left. I love the patient interaction. I like how impactful it is. And if you know, the skin is the biggest organ in the body, and there's so much that goes on with the skin. I just really enjoy being a dermatologist in training.
That's awesome. Very cool. Yeah, it's kind of funny, when you talk to someone, who's finally picked their, the route that they want to take for dermatology, and how it doesn't always start there. Like they start somewhere else, they think they have this focus of what they want to do, and then it completely changes. Exactly. But yeah, dermatology, like you said, skin's the biggest organ, so it's going to cover so much, and it's fun. I think it's a lot of fun. Okay, so kind of what we want to talk about today are some skincare basics, kind of go over a little bit of just like groundwork basics, and kind of go from there about what everyone needs as far as skincare, important ingredients that you think that everyone could benefit from, maybe some skincare concerns that might get overlooked by a lot of people, but that a lot of people suffer from as well, and just they don't know about them or anything like that. So let's kind of dive right in and start with the basics. What would you say are just some either basic skincare products that people could use for their skin, or just something that everyone needs to know about taking care of their skin to look their best?
Absolutely. So I think in this day and age, we have so many skincare companies and products, and I think people really get so confused because they go to the market and they're seeing so many products. Mm-hmm. Personally, I think once you want to have a really good skincare regimen, there are three main important things you need to have. One would be a cleanser. Cleansing is so underrated, but I think it's so important. When you cleanse your skin, you actually prep your skin to absorb the serums and all the other ingredients you're going to use. Mm-hmm. Secondly, a moisturizer. Even if you have oily skin, you should always moisturize your skin. And I think there's a big misconception that oily skin doesn't need moisturizer, which is false. The last thing that I think is very important, which is the foundation of a great skincare regimen, is sunscreen. I don't care what your skin tone is. I don't care where
Yeah.
you're from. You should be wearing you should be wearing a sunscreen every day. There's no great skincare routine without sunscreen.
Right.
So outside of those three, the cleanser, moisturizer, and sunscreen, if you want to take up your skincare routine up a notch, then you can start with antioxidants like vitamin C. You can think about vitamin E. There's so many other things that you can use, but I think the basics would be a great cleanser, great moisturizer, and great sunscreen.
Okay. So it's good like jumping off point. Start with those, get those, and then you can add on if you want to afterwards. But those are the
Exactly.
basics.
Yes.
Awesome. Okay. Now when it comes to, your skincare routine, let's say you do have your cleanser, your moisturizer, your sunscreen, but you do want to start adding other things in like a serum or an eye cream or, retinol, something like that. So many people get overwhelmed by, number one, the amount of products, like you were saying earlier, that are out there. And number two, they might not know like how to apply them or how to use them and incorporate them into the routine that they have. So can you kind of give us a little bit about, kind of the order that you would want to apply your products and where those things would fit in?
Right. So skincare is not one size fits all. And I think it's so much better when you personalize your skincare routine. So, and I personally tell people to think about it in terms of their concerns. What are you worried about? Are you worried about acne? Are you worried about hyperpigmentation? Are you worried about aging skin? So let's start with acne, for example, or even hyperpigmentation, which is so common. If you, after you've gotten your cleanser, your moisturizer, and your sunscreen, then you want to add something like a serum. There's so many great serums. For example, niacinamide is a very good serum that does a lot of different things. I like it a lot because it's like jack of all trades. You can use niacinamide for hyperpigmentation. It helps to calm inflammation, which is really good for acne. If you have oily skin, niacinamide actually helps you reduce the sebums, which is so perfect. So if you start with that, you can do niacinamide if you're worried about hyperpigmentation, oily skin. Also, vitamin C is a very good antioxidant, which is very good, and also helps you increase your collagen production, gives you that firmness, that very radiant skin that everybody wants.
Yeah,
Another
absolutely.
ingredient that is really good would be hyaluronic acid, which helps you give you that plumpness. And there's so many different things on the market. One product that I really do love that I use personally is your product, Dermatology, the needle-less serum. I'm obsessed with it because it contains niacinamide and hyaluronic acid,
Yeah,
which is
it's one of
just
my
a two-in-one,
favorites.
exactly, two-in-one combo. So in terms of applying your products, you want to start with the lightest product and go to the heaviest. Usually it's your cleanser first. If you're somebody that uses a toner, you want to do a toner or your essence after cleansing, and then you want to apply your serum. I typically recommend applying your serum to a little, not wet skin, but like damp skin, so you can kind of increase that absorption of your products into your skin.
Right.
And then after your serum, you can go with your moisturizer and your sunscreen. If it's during the day or at night, then you don't need sunscreen.
Yeah, absolutely. Okay. So like you were just saying, day and night, you might need sunscreen in the morning. Obviously, that's not something that you need at night. So are there other products that you would think that, a lot of people say, oh, I have to use this whole routine in the morning, but I have to use completely different products at night. Number one, is that necessary? Is there any benefit to, using certain things in the morning versus at night? Or can you use the same thing all the time?
You can actually use the same thing all the time. I know traditionally when it comes to retinoids, the older formulations will get degraded in sunlight. That's why it was recommended to use at night. But the new formulations that we have now, you can use them during the day. So it's not necessary to change your whole routine at night. But obviously, some people have dry skin and they prefer to use heavier moisturizers at night, which I personally do. So I think that'll be one thing that you might change at night, make you use like a heavier moisturizer that has peptides and ceramides for nighttime. And then during the day, you can use a light moisturizer. And you don't need to use a sunscreen at night. But you can use the same serums you use in the morning and at night so far your skin can tolerate it. I personally use my Nuless serum in the morning and I use it at night as well.
Yeah, that's an amazing serum. I love it. And like you said, it's got those amazing ingredients in it that work for every skin, tone, every skin type, which is amazing. The niacinamide, the hyaluronic acid, it makes your skin literally look amazing. So yes, it's definitely something you can use both. When it comes to the routine as well, there's some things that you want to use every day, like these that we're talking about now, like your cleansers, moisturizer, sunscreen, things like that. But things that you might want to use that you don't use every day, like an exfoliator or some sort of a microdermabrasion or something like that, that's going to exfoliate your skin and be a little bit harsher. How often do you want to use products like that? What are the benefits of those? Is it something that you should add to your routine or that people would want to?
So when you exfoliate, if you look at it, exfoliation just means you're pretty much breaking up the top layer of your skin. And that's $1 million question because it depends on the type of skin you have. If you're somebody that has a very sensitive skin or dry skin, you should not be exfoliating every day. I don't never recommend exfoliating every day because I don't think it's necessary, but exfoliating once a week, 2 times a week, or every other week, as long as your skin can tolerate it, is my recommendation. And also, there are two different kinds of exfoliants. You have the physical ones. Those are the ones that pretty much have the granules, like, sugar-based, salts in them. They feel a little like rough on the skin because there's something in there. And you also have the chemical exfoliants. So it depends on the product that you're using. And also, there are some exfoliants that come as toners that you can use every day. So it kind of depends on what you're using and what your skin type is. So it's not really like one size fits all for everybody when it comes to exfoliation.
Yeah.
But it's really good to exfoliate.
Yes. Okay. Yeah. There are so many different exfoliants out there.
Exactly.
Like you said, a lot of them are in toner based or things like that, or any type of acids that you might use. Our microdermabrasion scrub, for instance, it's one of those that have very, very fine granules in there. But oh my gosh, I use mine probably twice a week, and afterwards my skin feels so smooth. Like I love it. It works amazing. But yeah, it's definitely not something that you would want to use every day. It might be a little bit too harsh for your skin.
Exactly. But surprisingly, some people can exfoliate every day without any issues. So it just depends on your skin and what it can tolerate. But I never really recommend daily use of exfoliants. It's not necessary.
Right. Okay, kind of moving on. We're getting some questions here. Okay, back to sunscreen. The proper way. What is the proper and correct way to apply sunscreen? How often should you apply it? Can you use too little? Can you use too much? Just kind of give us a little bit of the one-on-one on that one.
So the recommendation is if you're going to cover your whole body with sunscreen, it should be a shot glass of sunscreen. And if you're only going to treat your face and your neck, it should be half a teaspoon. But we know that most people do not apply sunscreen correctly. And that's why it's always recommended that if you're going to be in the sun for a while, try to reapply every 2 hours. Because when you sweat, when you swim, you actually lose efficacy of the sunscreen. So sunscreen every day, even when it's winter outside, you should always wear your sunscreen. And don't forget your ears, your neck. Wintertime, everybody's wearing a jacket, we're wearing like sweatshirts, but your ears should always be covered and your neck should always be covered. And in the summertime, every area of your body that's exposed to the sun should be covered with sunscreen. And you should try to reapply every 2 hours as much as possible.
Yeah, even if you're not just going to be laying out at the beach or at the pool, when you're outside, like you said, any of those skin that is, open and exposed to the sun
should be covered.
Yeah, absolutely. It needs to be covered. It's not just for when you're laying out trying to get a tan. When it comes to sunscreens, there's chemical, there's physical. Now there's these hybrids of the two. Can you tell us a little bit about the difference between a chemical and a physical, and or some of these hybrids, is one better than the other?
So it's based on the ingredients. The mineral sunscreens, also called physical sunscreens, are the ones that tend to contain zinc and titanium. And the problem with those is that when you apply them directly on your skin, if you're somebody of color, they typically give you that chalky look and just look, not cosmetically pleasing. But now we have tinted sunscreens that help you with that. So, and I think traditionally the biggest problem with this sunscreen is like, if you're a person of color, it's so hard to find one that you really like without getting that, white cast. And then the chemical sunscreens are the ones that have like oxybenzone, octinoxate, and we also have the hybrids, which contain typically zinc oxide and octinoxate. It doesn't matter. The most important thing is that you're wearing sunscreen and you're using it daily. That's the most important thing. I tell people when you ask me for recommendations, my recommendation to you is to wear the sunscreen that you love and you wear every day. However, given the new, the media about the side effects or like the absorption of some chemical sunscreens, I know people typically try to stay away from chemical sunscreens, but today I'll tell you that there's no paper that talks about the side effects of chemical sunscreens on humans. I haven't read anything at all, and I've looked through the literature. There's no documented adverse effect. However, some are thinking about maybe there might be some hormonal dysregulation with some chemical sunscreens. So I personally always recommend 100% physical sunscreens to pregnant women and also to little kids. If you're not pregnant, if you're not a child, it's okay to wear a chemical sunscreen. And these are the ones that contain like I mentioned, oxybenzone, octinoxate, and all the other avobenzone and all the other chemical filters. And in terms of the way they work, traditionally we were taught that physical sunscreens kind of sit on your skin and prevent the rays from penetrating. But newer studies are showing that you actually do have absorption of UV rays regardless. It just kind of absorbs and then scatters, just the same way the chemical sunscreens work. So in terms of like that, they work the same way. And I think the biggest difference is just, thinking about like if you're a child, if you're pregnant, just giving like, the concern for hormonal dysregulation. We just always just recommend 100% physical sunscreens for pregnant ladies and little kids. And if you're not in that category, you can wear a chemical sunscreen. The most important thing is that you are wearing the sunscreen, you're wearing it every day.
Right, exactly. The best one, like you said, is the one that you're actually going to use, the one you're going to put on every day, that you're going to, you know what I mean? I honestly, I'm going to be honest. Before I started working for dermatology, I never wore SPF on my face because it was like you were talking about earlier, the white cast, or it felt super heavy on my skin and my skin looked greasy all day. So kind of learning about the chemical versus the mineral and what the hybrids are and all that kind of stuff. I honestly have fallen in love with the sunscreen that I wear every day. I switch back and forth between our broad spectrum, which even though it's white when it comes out, it goes on clear for every skin tone. It blends in seamlessly. And our universal tint, I use like kind of on those days when you don't want to do makeup, you just want a little bit of something to give you a little glow. Again, even though it's tinted, it still blends in with every single skin tone.
Exactly.
Those two are my favorites. And I do, because I love them, I wear them every single day. And it's like you said, it's the number one most important thing that you can put in your routine is sunscreen. So
and then going back to that talk of sunscreen, there are some people who have allergic reactions and some chemical filters. To those people, I always recommend going to the physical blockers. I am one of those because I actually did a patch test and I'm allergic to a chemical filter. However, I do use a hybrid one from dermatology, which contains octinoxate and zinc, and I've been fine. I haven't had any allergy. And I think my culprit would be, I think I want to say it's the oxybenzone that I'm allergic to, because it never really tested for the particular filter, but I think that's the one I'm allergic to because it's the most common cause of contact allergy when it comes to sunscreens.
Got it. Okay, well, that's good to know too, because a lot of people do have reactions and they don't know what it is that's causing it. So they don't even know where to begin. So they just stop using it altogether and they don't find one like that actually would work for them. So it's kind of good that you said that. So maybe they can kind of start there and see if that's what they're allergic to and then find one that would work for them. Okay, a question that did come through. Someone's looking for a good moisturizer. So what's a good moisturizer? Just kind of a basic one that you would recommend to someone. Are there certain ingredients in a moisturizer that make one better than another?
Moisturizers are like one of those pretty much the very easy product to find. You don't have to spend a lot of money on moisturizers. There are a ton on the market. I always recommend oil-free moisturizers to people that have acne-prone skin because I just find that way you're not using any ingredients that can clog your pores. You don't have to get a $50 moisturizer to have the benefits from moisturizing. So I'm currently using, I use the Hydro Boost by Neutrogena, and I use that in the morning. I also use it at night, and I also sometimes layer my most times I layer my regular moisturizer with my sunscreen from you guys. Sometimes I use the tinted one that is already a moisturizer and sunscreen together, or I use the regular one that's just a sunscreen. So it doesn't really matter. I really like the Hydro Boost one. It's marketed for really dry skin, but I personally think it's great for oily skin because it's not greasy and just feels very light on the skin. Other moisturizers that I've tried and I really loved, I have tried some from La Roche. They're really good. And for nighttime, I really like your peptide moisturizer for nighttime. I think it's really good. It kind of helps you just repair your skin as you go to bed. So that's a good one too for nighttime.
Absolutely. It's loaded with peptides and ceramides, all this great stuff. And honestly, it is such an amazing nighttime moisturizer. I know earlier you said at night, you sometimes maybe want to use a moisturizer that's a little bit thicker. Honestly, love that one because it's so luxurious and it feels so good when it's on your skin, and it works for you all night long. So yeah, I love that one too. Okay, another question that has come through. Okay, anti-aging. What's the best age to start using anti-aging products or starting to get anti-aging procedures?
In terms of products, you can start now. It's never too early to start. And the number one product for anti-aging is just sunscreen, because you want to protect your skin from the sun. The
Okay.
sun will cause your skin to have wrinkles early, will cause like dyspigmentation. So that's one. Once you have your sunscreen on lockdown, the other things that you can think about would be topical retinoid. And retinol is just an umbrella term for vitamin A derivatives. And we have, like, over the counter, you can have the retinol esters, you can have the retinol. And then when it comes to retinoic acid, it's usually the prescription strength medications that you get from your dermatologist. You know, and funny enough, like, we typically recommend retinoids for young kids that have acne, because that's number one treatment for acne is like a topical retinoid. So it's never too early to incorporate that into your skincare routine at all.
Okay, great. And then when it comes to like procedures, is there a certain, I know some people, you know, get procedures, you know, once they've already seen all these issues on their face that they want to fix. Some people get them done because they want them to be preventative. Is there a best time to start that? Or is that kind of like with this, where it's anytime?
Well, I think it depends on the person. It depends on what your concerns are and what you're trying to fix. Now, a lot of dermatologists are actually saying that getting Botox a little early actually helps. When, like, you're kind of like chasing the agent, because you're giving your muscles a chance to relax. You're not constantly contracting your face. Because if you think about wrinkles, it's like from constant, like, you know, muscle contraction, and then you start to see all those lines. So the thought is that if you start Botox a little early, you give your muscle a chance to just relax, and maybe you might decrease you might kind of increase the age as you
Keyword,
develop.
maybe.
It's possible. You know, I personally started getting Botox when I was 28 to 29, I think. Prior to that, I never got Botox, and I really do like it. I like the way it makes my skin feels. It's temporary. It lasts about 2 months or less. For some, it lasts for 3 to 4 months. It kind of just depends on you. And then when it comes to like fillers, it also depends on you. If you already have visible sagging of your skin or volume loss in your skin and you want to correct that, you know, you can talk to your local dermatologist and see if it's the right time for you to get fillers. But there's no exact age to start procedures. It just depends on what you want to achieve and what your skin goals are, you know.
Got it. Okay. I did just see a question pop up, and I think it's a really good one because I've run across this a lot with some of our customers. They were asking, after you use vitamin C on your face, like a vitamin C serum or anything like that, is it okay to use like a peptide night cream after that? So kind of to add on top of that as well, after you could answer that, are there certain ingredients in products that you want to use separately and not use together? Maybe they, you know, would lose their efficacious properties or anything like that.
Right. So the first thing that you want to worry about is irritations, because you don't want to use too many products that will irritate your skin. When it comes to vitamin C, with the most common active ingredient is the ascorbic acid, which is quite unstable. That's why you want to look for a product that has vitamin E as well as ferulic acid with it.
Right.
And the hypothesis is that when you use copper peptides with, you know, a poorly formulated vitamin C, you can actually have a reaction. So that's the only instance I know that you want to probably look at your vitamin C and make sure they're really good product before you layer with a peptide. And if it's not a copper peptide, then you're fine. Otherwise, you can layer your products. You know, peptides are pretty much from amino acids, and your body naturally produces that anyway. So they're really good. And then layer your vitamin C with, you know, you can layer your vitamin C with any type of moisturizer you want. Just make sure like it's a good vitamin C if you want to use a moisturizer that contains copper peptides.
Got it. Okay. So kind of jumping on that train, this is something that we've come up with a lot. We have our needleless serum, and then we also have our vitamin C with ferulic acid. So that's where the copper peptides and vitamin C come in. This is why we recommend for our customers who use both serums, not to use them together. If you're going to use your vitamin C with ferulic acid, we say use that in the morning time, and then use your needleless serum at night because they have the copper peptides in there.
Right.
So you're still going to get the benefits of both of them. You don't have to choose one or the other. Just don't use them together at the same time. Use one in the morning and then one at night.
Exactly. It's just like saying using the vitamin C and a topical retinoid. We always recommend using your vitamin C in the morning and your retinoid at night, because you don't want to use both of them together at the same time, because it can be irritating depending on what kind of skin you have.
Right. Okay. Are there any other ingredients that you can think of off the top of your head that might not go best together that we should avoid?
I would say like just using multiple acids at the same time. That's just too irritating for your skin. You don't have to do that. It's like washing your face with salicylic acid and then trying to use a glycolic acid pill right after. It's just too much. Like, You know, you can use those
I
ingredients.
speak from experience. That is absolutely right.
Just too much. You know, I think the problem is that people try to over exfoliate, maybe by accident, also because of, you know, misinformation as well. We read so many things online, but we just don't know how to properly incorporate these things into our routine. And I always say, even if you're getting a product for the very first time, especially acids, I always recommend starting slowly. Use it once a week and see how your skin tolerates it. And then you can increase as your skin tolerates. You can use it twice a week or whatever you want to do it, provided your skin tolerates it. You know?
Very, very important part. If you're starting anything new in your skincare routine, start with one product at a time and give yourself time to make sure that your skin is going to receive it well, accept it well, not have any type of irritations. Because if you start too many all at once, you don't know what, you know, what the instigator is and what's, you know, causing all of the issues. So start slow, one at a time. Very, very good point. Good point. Okay, this is another one that came through, and I think it's really important. This one is specifically geared towards acne. It says, can diet really affect acne, or is that a myth? I'll even take that further to say, can diet affect your skincare, whether it's acne or not? Can it affect your skin?
So, yes, the answer is yes. However, acne, you know, is an interplay of different things, hormones, your genetic predisposition. So I would say like studies have shown a few things that if you eat things that have high glycemic index, like processed foods, sugars, it actually increases your blood sugar. And that has a role in acne. It's been studied. And another thing that's been studied really well is skimmed milk, because when you do the process of skimming the milk, you're removing the fat from the milk. And then you're leaving, they said, there's some people think that you're leaving the hormones from the cows and everything else, and that kind of drives your, you know, the acne process. But it's been shown that acne can be worsened by drinking skim milk, as well as eating things with very high glycemic index. And another thing that I always talk to my patients about, say my young men, they're very athletic, would be whey protein supplements. We've seen a lot of acne exacerbation when people do take some of these supplements. So it's important to
really?
Yeah. Whey protein is very notorious for causing acne.
Good to know. I should tell my son that.
But also, I just want to make it known that, you know, it doesn't mean that, you know, like I mentioned, there's a genetic predisposition and also like hormonal background for acne. It doesn't mean that everything you eat is going to make you break out. But if you feel like you're breaking out eating certain food, I think it's important to just kind of have like a food diary, so that way you can document what makes you break out more or not. So, but definitely if you have acne prone skin, try to stay away from whey protein and skimmed milk, and also try to eat, you know, more vegetables, and try to reduce your intake of high glycemic index foods.
Got it. Very helpful. Let's see. We will go back to retinol. We talked about it a little bit. To some people, retinol, retinoids, it's a very scary word because there is this, you know, stigma around it that it's very strong, and which it is. But there's so many products out there now that contain retinol, and they're all at different strengths and things like that. Can you tell us a little bit, number one, about retinol, you know, what it is, what it does, what it, you know, how it benefits our skin? And then is it for everyone? You know, if you have sensitive skin, can you use retinol as well?
So retinoids, that's the umbrella term for every vitamin A derivative, you know, derived product. And and the name is pretty much determined by the strength. So you start with the retinol esters, you move to the retinols, then retinol, and then retinoic acid. So the retinoic acid, most of them are by prescription only, and they include like things called, you know, Araslo, Acleve, the different ones. They are very good because they do a lot. And if you know the way acne forms, pretty much you have like your cells that kind of gumming together, and then you have like increased oil, then bacteria gets there, everything gets inflamed. So what a retinoid would do would kind of help you break up that gunk that's forming together, and that would, you know, kind of not really exfoliate, but in a sense it kind of exfoliates your skin a little bit. But even though we don't really consider an exfoliant, but it does by you know, breaking up the cells a little bit. So that way, we call it keratinization, kind of like just smoothing out your skin and makes it really smooth. And another thing that it does is helps with hyperpigmentation. So if you are somebody that has acne and you're a person of color, every time there's any inflammation in your skin, the natural response of your skin is to produce melanin. And that way, you know, you want to kind of treat and reduce that melanin production in your skin. So retinol does that. 3, retinol actually increases the collagen production. That's how I was saying that usually people think that retinol thin out your skin, but it don't thin out your skin. It actually help you increase your collagen production and give you that firmness that everybody really wants.
Absolutely.
Yeah, exactly. And that's one. And then oral retinoids are actually the only things on the market that can cure quote unquote cure your acne would be like Accutane. But that you have to be, you have to see a dermatologist for you to get Accutane. But in terms of just like over the counter retinols, I would say that they are really good, but they are not as effective as the prescription strength, as you know, because like the retinoic acid is what really does the job in your body. Everything else that you use has to be converted to that in your body to give you that efficacy that you're looking for. So if you're starting from a very, very mild over-the-counter retinol that doesn't really, it's going to take a while for it to get to that retinoic acid because it has to go through multiple steps. So but all like your question was like, can you use a retinol if you have very sensitive skin? The answer is yes. There's always something for everybody. And if you have very sensitive skin, you can start really slowly and you can just increase as your skin tolerates it. So there's always something for everybody.
Okay, awesome.
The
you kind of mentioned.
I was going to say the only instance that I don't recommend retinol is if you're breastfeeding or if you're pregnant. You should not be using any vitamin A or containing ingredients like retinols or like retinoic acids.
Good to know. Thank you. You mentioned how it was very helpful too with dark spots, hyperpigmentation, things like that. That kind of brings us to, some skincare issues or concerns that sometimes, that's a very common one. I feel like people get dark spots or, they start to see them as they get older, as they start to see the signs of sun damage from when they were younger and covered themselves in baby oil, things like that. But what would you say are some skincare concerns or things that a lot of people suffer from, but people might not really know about or know what they are or, what's causing them?
I would say rosacea is one that I think is very common that people often misdiagnose, especially people of color, because typically if you're a type 1 or type 2 skin, meaning that if you're really fair, some of the signs of rosacea would be redness around your center of the face. You can see some blood vessels there. And then sometimes they get like pustules, meaning like just tiny bumps that kind of contain pus. This would be like common signs that people have. However, some people do get confused and think that's just regular acne. And sometimes when you use regular acne medication for somebody that has rosacea, it makes their skin even more sensitive. So you have to be very sure what you're diagnosing and what you're recommending. Other things that I think people often misdiagnose or don't know they have is eczema. People just see some things on your skin and just wonder, what is this? I don't know what it is, but a lot of times it's just eczema. And sometimes it's eczema worsened by facial products that they are using. So
what exactly is eczema? Like, what does it look like to someone who wouldn't know what it was?
So eczema can look like, for somebody that's fair, you can just see a red scaly patch on the face that maybe itchy. That's one of the criteria for eczema. It's typically very itchy. And in younger people, it pretty much affects like the elbow areas, kind of like your like inner like elbow areas. In babies, you can see behind your legs. In adults, you can see pretty much anywhere on the body. Sometimes it favors the ears, and some people pretty much can affect any part of the body. And I'd like to explain that eczema is like dry skin, so to speak. Your dry skin is very itchy. There is a very strong genetic predisposition to getting eczema, so it kind of runs in family. And a lot of people that have asthma also have eczema. It's like a triad. They have allergies, they have asthma, and they also have eczema.
Oh, wow.
That's a common triad that we see a lot.
Interesting. One thing too, and I kind of mentioned this to you when we talked earlier. One thing that I didn't ever really know about beforehand was something called keratosis pilaris, or KP, as a lot of people say it. And this was something that I learned about because we have our exfoliating body lotion, and that's what it's geared towards, is for people with keratosis pilaris. And I had no idea what it was. And when I learned what it was, I realized, oh my God, my son has this. And, can you just explain what that is and how common it is and the things that you could do to help it?
So keratosis pilaris just means when you have keratin clogging your hair follicles. And a lot of people do have, it's actually quite common. And common areas that you will find it would be like the outer like arms, the thighs. Some people call it strawberry legs. I don't really like that term, but if you get strawberry legs, you understand what you're talking about. Or like goose bummy skin, just kind of, or chicken skin. People do call those, I don't know why they call them that, but these are like the common names for that.
Right.
And it's pretty much when your hair follicles are getting clogged by keratin. And keratin is something your body naturally produces. A few ways to kind of combat it would, number one, you have to know there's no cure for it, but you can manage it. So, it's good to have a realistic expectation of what you can achieve with the treatments.
Right.
It's good to exfoliate because you want to remove the keratin as much as possible, but you want to try to make sure you don't over dry your skin, because when you over dry your skin, you actually make it worse. So some things that I do like that I've seen work really well in my patients would be like salicylic acid body wash. That is really good because the keratolytic, like I mentioned, is the keratin clogging the pores. So you want to find something that can pretty much reduce the keratin that's clogging the pores. So salicylic acid is a very good one that you can use the body wash. Two, you want to make sure you moisturize your skin really well too. You can use a urea-based body cream, because urea actually is a keratolytic too. Keratolytic just means that it breaks down keratin. So that's a really good one too. Another thing that I do like for my patients when I can get it covered would be a topical retinoid that we talked about already. That also kind of helps you smoothen out the skin as well.
Wow, it sounds like retinoids and all that kind of stuff. It like covers so many issues.
It really does a lot. Like, it does a lot.
Yeah, it's awesome. Okay, we're gonna do one more question real quick, and then we're gonna go ahead and wrap up.
Okay.
But I just want to jump on and say to everybody, if we didn't get to your questions today, please still send them in. Or if you get, if you think of a question when the live is over and you're like, oh my gosh, I should have asked Dr. Ruth this, please still leave a comment, message us. We will absolutely answer the questions. We will answer all of them and get back to you. But okay, this one is kind of going back to the ingredients we were talking about before, and how, you hear these conflicting stories about whether something's good for you or whether it's bad for you. And then one day it is, one day it's not. So this question is asking about silicones in skincare and skincare products. Are they a good thing? Are they a bad thing?
Okay. So I think silicones are like one of those ingredients that have been demonized by social media. I don't know why, but pretty much I think it's just because of misinformation. Silicone is not toxic at all. It's like naturally occurring, and it's actually very good in moisturizers for many reasons. One is an emollient, meaning that it's something that can help you smoothen out your skin and make your skin really smooth. Second is an occlusive, meaning that it would help your body reduce the rate of water loss. So when the water evaporates from your body, it actually makes your skin really dry. So you want to reduce the rate of evaporation, which is called transepidermal water loss. So silicones actually work really well for that. And if you know, like Vaseline is an occlusive, but silicone is not as thick as Vaseline. So I prefer to use moisturizers that contain silicone for that benefit, because it will help your body reduce the rate of water loss and keeps your body really, really moisturized and hydrated. My current moisturizer has dimethicone, which is a kind of silicone in it. There's no study that have shown any adverse effect of using silicone in skincare to date. So I don't know why people really demonized it, but it's actually a very great skincare ingredient. And I don't think anybody should be afraid to use any products containing silicone in it. And I think people kind of just, get confused when they hear silicone. They think it's some chemical ingredient that's so toxic. It's not toxic at all.
Exactly. Well, I mean, kind of jumping on that train too, I think people hear the word chemical and automatically they think that it's this terrible thing. You don't want to add any chemicals to your body, when they don't realize everything is literally a chemical. Water is a chemical. So, I mean, there's those, I think, like you said, stigma words. You don't know why someone latches onto them like that. But thank you so much for explaining that, because I didn't know a lot of that either. So you debunked some myths for us today. Thank you. We are going to go ahead and wrap up. Like I said before, if you guys have any questions that we didn't get to, please know that we will get them answered for you. Send us a message if you think of something later. We will absolutely help get the answer for you. We'll talk to Dr. Ruth and let you know what she says. But we just want to thank everybody for coming today. We always repost these after the fact on our Facebook page and things like that. So please feel free to share it with your friends. It was loaded with lots of really good information. So be sure to share that with everyone. But thank you all again for coming to see another segment of Derm Talk. Dr. Ruth, Thank you for joining us. It was
Thanks
so
for
much
having
fun.
me.
You
Thank
gave us
you.
a lot of great information. So thank you so much for being with us today.
Thank you. Have a good night. Thanks
Thank you,
everybody
you
for
guys
joining.
too. What was that?
I was saying thanks for joining.
Absolutely. It was
I
fun.
think somebody had one question about eye serum.
Uh-huh.
I can just answer that really quickly.
Go for it. Yeah.
It's like, is eye serum really necessary? No, it's not. It's not necessary at all. You can use a regular moisturizer. However, if you have specific concerns like hyperpigmentation or puffy eyes, then you can get products that cater to that. But it's not a necessity at all. But it's a good,
Okay.
a
So
good
yeah,
add.
kind of going back to the eye cream too. Eye cream,
Yeah.
eye serum. Is it something that you need to use, like added something different than your normal moisturizer?
No, like I was saying, it's not necessary at all. But
Okay.
there are some serums that treat certain concerns like hyperpigmentation, puffy eyes. And if you
Mm-hmm.
fall into that category, then you can get a product that has ingredients that help those. But if you don't have any issues at all, you don't have to use a special eye cream or eye serum at all. However, if
Awesome.
you want to splurge on skincare, as part of self-care, you can get yourself a really good serum that you love or eye cream and use it. It's
Show
it's
those eyes some
fun.
love.
Yeah, it's part of it. It's part of it.
Awesome. Well,
Yeah.
thank you so much. I'm glad you saw that question. I missed it, but I'm glad you were able to address it. So again, thank you so much for your time and for
Thanks for
being with
having
us.
me.
And again, we'll get back to all the questions that we weren't able to get to. But
Sounds
thank you
good.
guys.
Bye.
All right. Bye.